one of the common features of heart failure is congestion or fluid retention, and we ask patients to monitor themselves and to watch for signs of fluid retention. What we ask people to do is to record their weight every morning. Weight is a useful indicator, a useful tool to pick up early signs of fluid retention. So we ask people to start off their day by weighing themselves first thing in the morning, to use a reliable bathroom scales, which they keep in the same place on a hard, flat, level surface. When you get up in the morning, you need to empty your bladder and then stand on the scales and record your weight in your notebook. By recording your weight, it allows you to track your weight and you'll be able to see any subtle changes. The guideline we give our patients is that they should watch for a 2 kilogram or 4 pound weight gain over 2 days. If this happens, we want them to recognize that as a change in their symptom or a problem that they should do something about. We'd recommend that they contact their doctor or their heart failure clinic. Breathlessness is another common feature of heart failure, and most people with heart failure will suffer from some degree of breathlessness. We ask our patients to monitor their breathing and to know what's normal for them. A good way of monitoring your breathing and how well you are is to notice if you can do what you think you should be able to do on a normal day. So if you can climb your stairs comfortably, if you can walk your dogs comfortably, or if you find you're getting breathless, doing less. If you notice this, you should contact your GP or your heart failure service. If you do wake up during the night and find yourself very breathless, you should add extra pillows and keep yourself well propped up. If you've woken up in the early hours of the morning, you could take your morning water tablets early, a little earlier than normal, and see if that helps to improve your symptoms. If it does, you need to contact your GP that day or your heart failure clinic and arrange to be seen. If you're very unwell during the night and you think you need to go to hospital, then you should call the ambulance. People notice that their ankles or legs can be quite swollen, and if you check your legs every morning as you're getting up or getting dressed, you can just use your thumb and press on your leg just above your ankle. And if you notice that your thumb is leaving an imprint or an indentation on your skin, that's a sign of fluid retention in your legs. And it's important to let your doctor or your heart failure service know if you're feeling that your stomach is swollen or your appetite is very poor. Again, it's a sign of fluid retention, and you may need to have your tablets adjusted or your doses of your water pills increased. Fatigue is very common. Again, patients should know their own body and know what's normal for them. It's important that you learn how to pace yourself and that you plan your day to allow periods of rest after periods of activity. For heart failure patients, if they are tired, there is no need to push through tiredness, and it is a good idea for people with heart failure to take a rest in the afternoon and to actually go to bed and to lie down for an hour or so. People often notice that they're dizzy or a little lightheaded when they change position. So if they've been sitting down or lying down for a period of time, they can feel dizzy when they stand up. So we recommend that you change position slowly, that if you're lying, you would move from a lying to a sitting position before you stand up. Or if you're sitting and going to standing, that you would stand up slowly and move off slowly. Dizziness can also happen after you take your medications. People can notice that they feel lightheaded or dizzy. If you do notice this, it is worth talking to your GP or to your heart failure service about it, because the dose of your tablets can be adjusted or changed and to make you feel better. Patients with heart failure often have a number of different tablets to take, and the regime can be quite complicated. So we would suggest that you build it into your daily routines, that you take your tablets at the same time every day. It's worth getting a little pill box that helps you divide the tablets into sections for morning, afternoon and night time, and it makes it easier to help you track of whether you've taken your tablets or not.